Lerato, and I think by far you're probably the most affected by last week, okay? The minister is concerned, he doesn't believe it's all him. Would you be able to, so just by way of introduction, just spend a minute on who the Health Funders Association is, and then just tell us what do you think is going to be the major impact on your industry?
Okay, thank you very much, and good morning to everyone in the room. The Health Funders Association is an industry body that represents medical schemes, administrators, and managed care organizations within the South African borders. So what we do, we're an advocacy group, we lobby. We would take care of any health policy developments that are happening, and we would obviously be the voice of our schemes. So we've got about 53% of the total scheme lives that we have within the country, and we're growing phenomenally so. By becoming relevant, we're very dynamic, and we're really engaged in policy issues as and when they come up. So NHI obviously is just one of those where we are actively involved, and we're speaking on behalf of our schemes and looking at, as you said, what is the impact. It is large, it is big, but we're in it, and we're willing to engage to make sure that we come up with a proper solution for it. You know, as the minister said, it's about private sector and public sector working together. And that is what we are looking to do as the Health Funders Association. We're willing to pull all the ranks and everything that we can to make sure that our schemes eventually respond appropriately to the reform that we are now faced with.
Excellent. Next to you, Vusi, that medical practitioners and specialists are likely to consider alternative prospects outside of South Africa's healthcare system. Has that been your experience at the South African Medical Association?
Okay. Thanks, Elton. Good morning, everybody. A little bit about the SA Medical Association, just to give context.
Yes.
We are a doctor representative organization. We represent doctors both in the public and the private sector. We have a number of close to 17,000 doctors that we're representing across the board. So when we talk about these things, we're looking at it from the private practice perspective as well as the public sector perspective. I'd like to record that SAMA has been engaged with the issues of universal health coverage from a long time ago, as well as the bill as well. We've made submissions through the different stages of the bill, and we want to bring our members to an understanding basically of what this means, and hopefully then address some of the fears that have been engendered. In conversation with the members, I think there probably would be some who would be very concerned, and we think that the antidote to doing that is to be as transparent as possible. So we welcome the opportunity that there is, at least from the ministry side, a commitment to getting engaged. So as a position, SAMA, we fully support universal health coverage. How you do that becomes a rather different issue. So the NHI, as it stands, I think, has a lot of issues that we'd like to engage even more robustly. Maybe just to highlight one or two of those, in terms of answering that question. We've got the contracting units for primary health care. The concern is really from, the historical perspective. There isn't a clear, I think, coaching of what the the provincial, department will be doing. We know that, there's a thinking that the district health management system will be taking over, some of those functions.
Yes.
That concerns doctors, because if you look at some of the things that have happened in the past, that is where the rubber hits the ground. You provide the services, you are not paid. And those are the things that probably would, actually want people to be thinking about alternatives as well.
One of the things I want to ask you practiced in Canada for a long time. A lot of people don't know that. And you came back to South Africa. So it'll be interesting to get your perspective of a system where this kind of thing does operate, okay? So one of those areas, I think, is in the financing everybody seems to agree that this is the right problem The problem is in the solution. And this is where I'm going to bring you in, Aneria. So you've spoken a lot about the tax implications of the funding of the NHI and those proposals. And I was wondering if you could take us through what is positive and what is negative about the proposals.
One of my colleagues asked exactly the question about what is positive and to get a positive spin on it. And I said, well, the positive side is that it's probably only in about 2026. And my colleague commented saying, well, that's about the only positive thing you can say about tax. At this stage, the tax is a very small part of the NHI bill. And we will only get details at a later stage when the money bills that the minister also referred to, when they will be introduced. So the irony at this stage is there are two sections in the NHI bill dealing with the funding of the NHI, while an NHI is in principle a funding mechanism. So there are two sections dealing with where the funds will come from. And we haven't got any details. What we know is that there will be allocation from other taxes which have already been collected, and then it is the new taxes which are concerning taxpayers. There is a talk about a surcharge. There have been no formal indication as to what it will be. The one thing that we can get a sense of the cost is losing the medical aid credits. And currently, for a family of 4 people, that's a saving of about 12,000 Rand a year. So that's the only thing that we can currently really put a value on. In all of the discussions from the health department side, they say that it's anticipated that the cost to the taxpayer will not be more than what we are currently paying for medical aids. And that is a very optimistic statement, and it's a very difficult statement to make because there are also indications that they haven't quantified the cost of the NHI. And if you haven't quantified that, then you can't determine the cost for the taxpayer. So we don't know, how will that surcharge be determined? Is it a percentage base? Is it based on what you are currently paying for medical aid, etc.? And there's a lot of concern from a taxpayer side, not knowing what it is going to be. And yes, it's only coming into effect probably in 2026. We will most likely lose the medical aid credits before then. But it's just another burden which is concerning taxpayers, coupled with whether the services will actually be on par with what we currently get with medical schemes.
Excellent.